Hi, I'm Dr. Aubrey Smith, an orthopedic surgeon in Amarillo, Texas. These are very serious times for all of us, and this outbreak has created a situation where we need to try to stay socially distanced as much as possible. But we have a problem because we need to still take care of you, and we want to be able to continue our care with you and take care of your problems orthopedically, whether you're an established patient or a new patient, doesn't matter. We need to be able to continue doing what we always do. So our response to this is to set you up with what we call a virtual visit. This is a familiar thing for many businessmen who have done these virtual visits and these group meetings online. We're going to set up a similar situation. It's just going to be more private. It's going to be HIPAA compliant. So we're going to be able to have an extremely private visit, a connection just between you and me. And that is really just not going to be as hard as it sounds. All of us have electronic devices. We have cell phones, we have iPads, we have computers that have cameras on them. All that's going to be required is that, basically. And so when you call the office, we're going to go ahead and get everything set up for a virtual visit, and we're going to see you just like we always do with all the same stuff happening. It's just going to be virtually, at least in the initial phases for new patients. And for established patients that don't need to see us, we're going to be able to do that virtually, literally most of the time, if not a great majority of the time. So there'll be a way for you to come to the office still if we really need to do that, but I'll get to that more later. Let's talk about this virtual visit. So we've collected all the information from you. We've gotten your MRI, your other notes. We've gotten consultation previously. We've had other treatment plans, op notes from before, whatever we need to gather up all the information that we normally need to do. Once that's all inputted into our computer system and you've had new patient x-rays, and if you need one and you live near Amarillo and Bailey needs to do it, we'll set that all up and it'll be very simple. You'll call when you're here, you'll come to the back of the building, Bailey will call when your turn, and you'll go into a very highly recently cleaned down, as clean as possible x-ray room, get an x-ray quickly, and you'll be going right back out the back door, and then we'll just move on from there. And once your x-rays are inputted, then we'll be able to set up your actual virtual visit with me. So you'll see me just like you always do, and we'll set up some type of a plan. If you're a new patient from very far away, we hopefully can get a lot of that done maybe near your town. Some of you are thousands of miles away that come to see me. This is going to be something that just really isn't that hard to do. And I have a feeling for those of you that live really far away, you're going to want me to do this a lot more than I'm doing it in the past. And I see this all coming once this thing is all passed. In any case, let's say you need a medicine. We can still do that. We can refill your medicines. We can do a new medicine electronically. We can figure all of this out. If you need to have exercises, our therapist is going to be here in the office and he'll be able to virtually demonstrate for you the exercises. For you post-op patients, you've got the stuff already when you had surgery. You'll just be needing to update on what those exercises are going to be. And for those of you that are new patients that need stuff to be able to do your exercises, we'll ship it to you. We'll make it available. We can even do a drop-by where you just come to the office, drive up, and we'll just run it right out to you. However it needs to happen, we're going to make it happen. Don't worry. What if you really need to go to a physical therapist, to their office? They've set up a system there where they've separated people out and they've got it all separated. They'll be cleaning like mad in between each and every patient. And if you're in there with any other patients, they'll be far distance from you in the corners of the therapy suite so that you're as safe as possible. They're going to make it as clean as possible, and they're going to make this thing as good as they can, just to make it as safe as we can possibly do it, because some of you absolutely have to go to physical therapy, and we can't ignore your health care during this crisis. We need to continue to be able to take care of you. What if you need an MRI? Our MRI situation is set up so that you're going to be separated a little bit from all the other patients, hopefully, or as few as possible, and they'll be cleaning like mad in between each and every patient, trying to make it as safe as possible for you when you go in to get your test. And then we'll be able to see it electronically just like we always do. Whatever our plan needs to be, if we can do it conservatively, we're going to do it conservatively and virtually. What if you do need to come to the office? What if it's really something that you have to do? Well, we're going to see you in the office, just like we always have. It's just going to be a little different. You'll come to the parking lot, call, you'll tell us you're here, and then we'll call you when it's your turn. And because we're separating people out so far, probably be really soon to the time of your appointment, and you'll come right on back. And you'll have kind of your own little private area that's recently been super scrubbed down. And then we'll see you, give you a shot, whatever you need to do. What if you have to have surgery? What about surgery right now? Our office has decided personally, right at this moment, to postpone surgeries for a short period of time until we can get a really good plan to be able to be as safe as possible for you, your family, and for all of the staff, and for everyone. Currently, the hospital, at the main hospital, is down to 0 visitors. At our hospital at Quail Creek, there are going to be 0 visitors. We're having refinements on a daily basis. I know that the board members are just meeting more and more, and they probably have had meetings all this whole week. They'll be meeting daily if they need to try to figure out a solution, to try to make you as safe as possible. Believe me, when we decide to go back to the surgery suites and do elective surgeries, we're going to be as safe as it can possibly be done, and you're going to be exposed to the very lowest possible threats of coronavirus available on this planet. In the meantime, we're going to get through this. We can make it through for a few weeks while we postpone elective surgeries. We're going to still do emergency surgeries, urgent surgeries, surgeries that are really critical. We're still going to do that. It's still going to happen. So don't worry. If you fall and fracture something, if something were to happen to you, we'll be able to figure out a way to get over there and get it done safely and as safe as possible during this time period. So there's a will, there's a way. The key here is for you to stay as safe as possible during this whole procedure. I know it's super inconvenient for everyone. Our office really loves to stay as busy as possible to help as many people as we can. But we're going to adapt. We're going to accommodate. We're going to get through this together. We are. And Amarillo, Texas is probably the place on the earth where we will see the flattest curve in the world if we'll all just participate as adequately as we can. Here's to our virtual relationship coming up in the future for the most part. And for all of you that really need to still see us or have surgery, that's still going to happen. So don't worry. Don't be concerned at this time about how it's all going to happen. It's just going to be a lot easier than you think. Call the office and we'll get everything set up. As far as this video deal goes, I've kind of figured it out. So I'll probably be updating this video very often. So check back frequently to see if we have any new information. And we probably will have more videos to explain even more things to you, to try to help you understand how we all need to get through this together. Matthew McConaughey said it exactly perfect, and I'm going to say it to you just like he did. We all need to take care of each other. Take care of yourself during this time period. Be safe out there. I'll see you virtually.